Hello. Hi, I'm Shreshtha Dhar. I'm a clinical psychologist, and thank you, Mekla Munshi, for inviting me over to speak about a very important topic today, and that is depression. So, let's talk about depression and what is depression. Depression is a clinical condition. It's a clinical condition which can be diagnosed by different mental health practitioners, for example, psychiatrists, clinical psychologists, and there are several symptoms of depression. And let's discuss some of the symptoms of depression, and then I'm going to take the questions which you guys are going to post over here. The three primary symptoms of depression are low mood, where one does not feel good. The mood, that is mon in Bengali, which is low, or mon kharab as we say in Bengali. Secondly, loss of interest, where a person loses interest to do anything. Nothing seems enjoyable or nothing seems interesting anymore. And finally, lack of energy, where a person does not find any energy, or suddenly there is a loss of energy to do anything around. Some of the other symptoms of depression are lack of concentration or inattention. The self-esteem or feeling about self becomes very low when the person feels that, I'm not good enough to do anything, I'm not fit enough to do anything. Extremely pessimistic views about the world, that everything around me is negative. The world is perceived in a very negative way, and it is seen that a person becomes extremely hopeless about the future, that the future is perceived to be very hopeless. A person feels very helpless. There is an overall helplessness. And apart from that, there are also important effect on a person's sleep. There is often diminished sleep. Sleep is reduced. Appetite is reduced. Also, energy, as I have mentioned before. These are some of the common symptoms of depression, and one which is more talked about most these days, that is suicidal thoughts or suicidal ideations. Those are also very common in depression, but in severe depression, not in mild or moderate depression, but in severe depression there are cases where a person can have suicidal thoughts or suicidal ideations. That is, a person feels that it's better to end my life, or it's better to finish everything, and life is not worth living. Okay, someone has posted a question. How can we understand if we have depression? Is there a periodic check or consultation that might be done by us? Since we are talking about this, let's understand how depression is different from regular sadness or sadness that we often experience. The most important difference between regular sadness or sadness that we experience often and depression is the time. Depression is diagnosed only after a person has been suffering through the symptoms that I've discussed before for at least 2 weeks. So the time is very important, and in case of just normal sadness, a person can feel unhappy for a day or two, and then the person starts feeling better automatically. And the other differences are that in normal sadness, a person, if that person starts talking to a friend or starts pursuing an activity which that person used to find interesting, and if that person starts doing it, then somehow after some time the person will start feeling okay again. But in case of depression, the person will continue feeling bad even though the person is trying to make himself feel better. Also, another very important factor, which is a very important factor in any mental condition, is that uh, any mental condition affects a person's socio-occupational functioning. That is, if a person is suffering from depression or clinical depression, the person fails to be active in his social life, like he or she stops talking to his friends, or doing regular activities where he's socializing, etc. And also his occupational functioning, where the person cannot work anymore, the person cannot do his regular work, he's unable to concentrate, etc. So if a person who is feeling sad but can go about his regular work and his regular social life, that is not depression. The person is actually feeling sad, and after talking to somebody, the person is going to be okay, or if the person gives it some time, he's going to be okay. But if it's a clinical condition, then the person will uh, have trouble doing the normal. And this is the basic difference between normal sadness and clinical depression. Also, in clinical depression, there are places, or there are factors where the person's biological functioning becomes extremely poor, like he becomes sleepless, he or she becomes sleepless, and he or she is not being able to eat. Finally, a very important factor to differentiate between clinical depression and normal sadness is the cause. Often, when it's just sadness, there is a particular cause, or there is a particular reason that the person is feeling sad. But in case of depression, there might not be any reason, there might not be any cause behind the person feeling that way. Uh, is there Definitely, if you go and visit a psychologist or a psychiatrist, there are various tests through which you can understand if you are suffering from depression, and these tests help diagnose depression as well. Another very important point is that there is no particular age in which depression can be affected. It can be any age or any time in a person's life that the person can be affected by depression, from children to young adults, adolescents, pregnant women, most importantly, people in their middle ages, old age. Everyone can be affected with depression. Someone has posted a question: why is it that depression is not treated as something we should consider? I did not get your question. Can you rephrase it a little bit? Okay. So someone has written, most of the time depression is overlooked, even if it's a marginal case. Why is this so? People are unaware that depression is a medical condition, and people often feel that, just by saying that, cheer up, or everything is going to be okay, uh, that people are going to be fine. And since most of us feel sad often, or sad among us, we often fail to differentiate between what is clinical and what is actually depression, and what needs to be given attention to. Why do so many people live with depression? People should not live with depression. People should actually go and seek help, even if it's for a short while, even if the sadness is short lived. They should go and talk, because even if it's sadness, regular sadness, that doesn't mean the person should not seek help. It doesn't have to be depression for a person to go and seek help. If people start acknowledging their sadness and if people try to be happy, they don't have to live with depression anymore. Someone has asked, how is depression diagnosed and treated? Depression is diagnosed by a psychologist. There are various tests through which the depression is diagnosed. They are mostly paper pencil tests. And treatment is, there are two types of treatment primarily. One is medical treatment, where the psychiatrists play a very lead role. Different kind of medications are applied for such conditions. And also the more recent treatment, that is psychotherapy, although it's not that recent, but psychotherapy. Sometimes psychotherapy works, sometimes medical treatment, sometimes both. But these are the two ways in which depression can be treated. And yes, your question, how can depression and talk around mental health be normalized? We should get rid of the stigma first. We should stop calling each other names, or if a person around us is feeling sad, instead of putting that person down, if we push that person or say that, it's okay to seek help, go out and seek help, rather than creating a taboo that don't go, what are people going to say, people are going to call you mad and crazy. These terms should not be used. And if we are aware around, if we are just taking care and just spreading awareness right around us, we can create a huge impact amongst many people. So get rid of the stigma first from our own side, and then we can help a lot of people around us. Yes, I agree with you that we need to have campaigns about depression. Thank you so much. Thank you for appreciating. I'm trying my best. How can the stigma around depression and taking help be removed? How can the stigma around depression? Just by doing this, talking about it more, spreading more awareness, being more considerate, being more nice, being more aware, and taking care of people around us. If you feel that, your classmate or your colleague is not doing well, not eating well, not overall taking care of himself, going and talking to that person instead of ignoring. We should all do that. We should all practice that. Be more careful, be more vigilant, be more empathetic towards others. This is one of the first steps we can take in reducing depression and spread awareness about taking help. Someone has asked a question. A lot of times patients are in denial. How does one advise a friend or family who is in depression that they need help without hurting them? In many mental illnesses, people are unaware. So in that case, we say that the insight is poor. When the insight is poor, we need to talk to the caregivers, most importantly, because that person is not in a place to help himself or herself. So if we talk to the caregivers and provide help to the caregivers, who are the indirect therapists over here, we can help out that person. And if the insight is low, then medication is primary, because medication will bring the insight back, where the person can start realizing what his problem is. So if the insight is poor, where the person does not understand, the person is in denial, medication is very important. So can we discuss some of the causes of depression? So one of the first and most important cause of depression is stress. Stress can be of any form, and stress differs from person to person. What might be stressful to person A might not be stressful to person B. Apart from stress, the other important factor is the genetic factor. So if there is any family history of depression, the person is more probable to be affected by this particular disorder. Apart from that, any form of abuse during childhood or any form of stress during childhood, it can be financial stress, relationship loss, job loss. These are few of the causes of depression. Someone has asked, I mean, why do people live with depression? Thank you so much. Any more questions? Psychotherapy is a very important mode of treatment for depression. There are various treatments for various forms of psychotherapies which are used for the treatment of depression, apart from antidepressants that I spoke about a few minutes back. Most of us are always running a rat race at work. How do we avoid stress and how do we ensure we have a healthy mind? Thank you for the question. We are all actually running a rat race, and right now, due to COVID and everything that is going on around us, there is a huge stress amongst us right now. So one of the first thing that we can do to keep a healthy mind is to maintain a very good habit, maintain good habits, the primary biological habits, where you are eating all your meals on time, getting sleep, some exercises done, because this is the very basic way to begin treatment for depression or any other mental illness, because we need to balance our neurotransmitters, and if we don't lead a very healthy life, then automatically we anyway start getting stressed out. Apart from that, in order to maintain a healthy mind, maintain a very good support system around us, where you keep friends, you talk to friends, you build a bond. You if there are problems that you're facing, make sure that you have somebody to talk to, you have someone to go to. Praise yourself for the little things that you do. Give yourself reinforcements, and try not to be too harsh on yourself. Find joy in little things that are there. Do enjoy what you are doing, and also be very aware of the negative statements that you are using, because in depression, like I've said before, negative thoughts are very common, where you've become very pessimistic, the thoughts are extremely negative. So keeping a track of the negative thoughts is very important, where you are recording your negative thoughts. If you have a friend, you can talk to that person about these negative thoughts, but if you feel that it's getting out of hand, or where it is taking a toll on your day-to-day life, then definitely going and talking to a psychotherapist is very important. Don't put pressure on yourself, and make sure that it's very important that we take work according to our own abilities. If you feel that the work is getting out of hand or it's getting too stressful, it's okay to let go of things at times. It's okay to just be easy and let go of things. Depression is growing amongst us around the world. What is your viewpoint? Yes, it is definitely growing amongst us. primary reason is lack of awareness, stigma, and we feel that it's going to be okay. But if we keep thinking that it's going to be okay, if we give it some time and we keep ignoring it, then it is going to take a toll on all of us. So we have to acknowledge that we are in pain. Yes, like I've said, note down your negative thoughts. Journaling definitely helps. And if you keep writing your negative thoughts, or if you keep a track of your negative thoughts, most importantly, you will understand what are the triggers of those negative thoughts. What exactly around the day is making you feel bad. It can be a particular work, it can be a particular person, it can be that if you keep journaling, then you will understand what exactly is making you feel negative. So journaling is very, very important in case of, we should all try it. It works wonderfully. Someone has written, Aratrika, lockdown already gives you different mood swings. How do we realize the signals for depression at the initial stages? So it's a very good question. So depression at the initial stages, the first few things that you will understand is that your biological functions are going to take a toll. You're going to observe that your sleep is getting hampered, or an overall general low mood, where you are feeling that nothing is feeling good. Your previously enjoyable activities, the things that you would enjoy before, like for example, if you enjoyed watching movies and suddenly you are feeling that I'm not finding any more interest to watch these movies, or you would have a very good time while you would talk to your friends, and suddenly you're experiencing that I'm not enjoying it anymore. It's not interesting to talk to my friends anymore. So this is when you realize that okay, there might be something, or maybe my sadness is growing more than usual. So definitely you need to talk to somebody at that time. Thank you for the question. It was a wonderful question. Someone has written, can you also talk about depression among kids? Also, if you can talk about how depression among kids and adults are different. So when it's a very good question, and thank you for addressing it. So how we experience depression and how kids experience depression, it's very different. So kids have two kind of responses to stress. One where they become extremely hyper, or they become extremely stubborn, they start throwing tantrums. Okay, that is one place where you need to think that okay, my kid is acting up a little bit, there might be something that is bothering my child. Or they suddenly become very quiet, or they become very they don't play, they want to go out and play, they don't want to talk to anybody, they're just sitting at the corner and doing whatever they want to. They don't want to eat, and previously maybe they enjoyed chocolate and they would ask that bring me this, bring me that, and suddenly they have stopped doing that. So if you feel that there is any difference in their behavior, they were behaving, they have a particular pattern in behaving, and suddenly it's become either too hyper or too they are not acting the way they usually would. That is when you would understand that there might be something that you need to talk to about the child. And like adults, children would never say that mom, dad, I'm feeling low, I don't feel like doing this. They will never acknowledge, or obviously because they are children, they will not be able to, they won't understand what they're feeling. But this is how it's different. When an adult would say that I'm not feeling good, and I'm not feeling well, something is wrong, the child will not be able to say. So you can observe that through their difference in behavior. It's a very good question. So what else can we do during the lockdown to make ourselves feel better? Avoid substances, because substances can cause more problem, mental illnesses overall. Stop taking alcohol, cigarettes, or marijuana, because these have tendencies to make you feel low. Alcohol overall has a very bad impact on our mood. Most of the substances, they give a very good high. The high is extremely nice. We tend to take substances because we enjoy the high, but the low is extremely difficult to handle at times, and that can cause depression. So avoid substances. Question from Shohini: what if a person facing depression have trouble communicating their daily troubles and tend to discontinue treatment after a few sessions? How does one motivate them? This is a very important question, and thank you, Shohini, for addressing it. Psychotherapy does not. Therapy is a long-term process, not long-term as in it will not continue for 10-15 years, no. Long-term as in it will not be just one session. A person will not see the impact of therapy in just one session. It's going to take at least a month or two for a psychotherapist to understand, primarily because when a psychotherapist is dealing with depression, the psychotherapist is working with the person's past, with the person's thoughts, the automatic thoughts of the person, which are mostly negative, and that takes time. Why? Because in order to change those negative thoughts, negative automatic thoughts, to a more adaptable alternative or a more positive thought, it takes time. And everybody has a different way of thinking. It's not same for everybody. Both the person might be suffering from depression, but the negative thinking might be completely different for two individuals. So it takes different course of time. It takes a different amount of thinking and a different kind of way to deal with two individuals who are suffering from depression. And yes, it is very common where clients tend to discontinue therapy or discontinue treatment after a few sessions. In that case, what I do is I often ask them that, is the treatment helpful? Are you finding it helpful to work with me? In case if they say that no, it's not, then we think about some other alternative. But if the person is seeking help, and if the person is undergoing depression, therapy will help that person in some way or the other to make it better. Even small changes with a person experiences, he tends to feel happier, he tends to feel better. So always talking to the client about what if the treatment is working always helps. Any case studies you would like to discuss, and how therapy has changed their lives? Yes, case studies I would definitely discuss with you, but I would have to think about it. In general, for clients who are suffering from depression, the symptoms are more or less okay. Are more or less the same, where there is diminished sleep, there is loss of interest, sudden lack of motivation, and the causes that are found are mostly stress from workplace, not being able to lack of satisfaction from work, or often, which is a very recent, that is sudden loss of a relationship or loss of a person can lead to such situations or such a condition. But therapy has changed many of their lives, but many of their lives in various ways, where if a person, for example, if a person is undergoing or is undergoing a relationship breakup, or say a job dissatisfaction, then changing his or her viewpoint towards life, or viewpoint towards what that person values in life. Right now, because of, someone has written, yes, right now because of COVID, because of the current stressful situation, it is better if we take one day at a time. Focus on one day at a time uh, that we have right now, instead of thinking that what is going to happen in the future or what is going to take place in the future, because we are all undergoing a time of uncertainty, of we are very unsure as to what is about to happen to us. But if we take one day at a time and focus on what we are achieving uh, today, it is going to make it easier for us. Case studies are very difficult to discuss over live sessions, but I will surely do something about it. Thank you. And while someone has written about journaling, it is also very important when you are writing about your negative thoughts. If you are just dealing with sadness, you can also write down the positive things that went today. That what are the good things that happened today, and if you note them down, it's going to give you a positive reinforcement. Someone has posted a question. Uh, okay, so deficiencies. Uh, deficiencies. Uh, okay, so your question is how it it would be better if you clarify what deficiency you are talking about. Okay, someone has written how to diagnose depression when the person is an introvert. This is a very interesting question. Uh, so, if the person is an introvert, you will notice certain changes in an introvert also, because introverts have their way of enjoying life. Introverts, even though they are quiet, they do not prefer so much excitement like an extrovert would do. But an introvert would you would notice certain changes in an introvert also. In introvert, introverts have a lot of friends. They talk about their feelings. So an introvert can a person who is an introvert would definitely spend more time thinking about his or her thoughts, and then the person can first of all definitely go and seek help on by by like himself or herself. Or if you are a friend of an introvert, we all have introvert friends, and friends can often understand that no, suddenly the thoughts of the person or the way the person looks at life has suddenly become extremely negative or pessimistic. That is when you can understand if the person is undergoing depression. Diagnosis is the same for everybody undergoing depression. Does any kind of deficiency, if yes, what are the main ones? Deficiency in terms of physical deficiency would definitely be it can definitely be some hormonal deficiency. uh, Hormonal deficiencies can lead to depression. Yes, hormonal imbalances can lead to depression. Yes, absolutely. Deficiency is hormonal deficiency, imbalances in neurotransmitters, because everything is linked together. So yes, various deficiencies can lead to depression. Any other questions? Many are not aware of this probable cause and should be added to awareness drives. Yes, like I've mentioned, that it's very important to maintain our ourselves. So maintaining habits, maintaining good habits, taking proper nutritional food is very important. And if a person is experiencing some kind of health problem, then the person should go to consult a doctor definitely regarding the health problem. And also the person should understand if that health problem is overall adding to that person's mental health problem. If that health is overall adding to that person's mental health. Supplementing can help the problem, but in case of depression, uh, this with supplementing there has to be other kind of help as well, because if the person is having negative thoughts or is undergoing some sort of a trouble, because again depression is caused due to various biological and environmental factors. So if the biological factor is taken care of, we also have to take care of the environmental factors which are affecting the person's mental health at the current moment. So supplementing will help, but the person should seek help otherwise also. uh, it is how important is it for a patient of depression to adhere to a disciplined life? Disciplined life is important for everybody to keep a balance, but again, it is we have to allow ourselves to be indisciplined at times as well, because if we are always just focusing on discipline, then we are missing out on a lot of other other happinesses that we can achieve through indiscipline. So discipline is fine, but sometimes letting go of discipline is also important. Discipline should not should always if you are talking about discipline, then yes, like I've mentioned before, sleep, food and exercise, these three things should always be taken care of. But otherwise it's not possible for a person to be disciplined all the time. So uh, it's okay to allow yourself to make mistakes and be indisciplined at times. That is also very important. Keeping certain rules are important, but breaking rules are also fine, because otherwise the meaning of life will be lost. Any other question? Okay, something about me. I'm a clinical psychologist. I have done my master's and my MPhil. I've done my MPhil in clinical psychology, and I've been working as a mental health practitioner as a clinical psychologist for the last 4 years. Um, yeah, what is it like to work in a domain like this? It is extremely enjoyable. It is extremely fun because it's fun, enjoyable, and it's very rewarding, because I get to make a direct impact on a person's life on a day-to-day basis, and it gives meaning to me. It adds a lot of meaning to my life. And yes, we have to take care of our mental health also, but overall it's a very, very rewarding field. Any other question before we uh, I have Shohini has asked a question. How does one motivate a person who has uh, lost interest to attend sessions. Uh, if you feel that, if you ever take your friend or a family member to a therapist, and if you feel that the person is not finding interest in that, is not wanting to go back to that particular doctor, that particular therapist, then ask that person why that person would uh, why that person is not feeling like going back. There must be some reason behind it, because if a change of therapist might help, uh, but don't give up. Even if that person has stopped going, attending sessions, uh, that doesn't mean that we give up. We will keep pushing, and talking to that person will give us insight on what exactly is not fitting. Can a person who has recovered get depression again? Yes. Very good question again. Depression is an episodic disorder. So there are a person who has suffered from depression. If that person has recovered by himself, or has taken help from a therapist, then that person, it's not like that person will not have a very similar episode again, because depression is episodic. It might occur again. It depends on the situation, the time, or maybe a stressor has occurred in that person's life, and that person can experience an episode. And if the person talks to a therapist, that therapist will definitely discuss with the person who has come out of depression, like towards the end of the session, that what are the things that the person should be aware of, or the person should take note of, uh, or consider when any there are very initial symptoms of depression, and it is very unique from person to person. And the therapist will definitely discuss with the client that, these are the initial symptoms that you are going to face, and this helps the person to understand, okay, so if I'm having these particular symptoms, maybe my episode is coming back, and then the person can seek help faster before the symptoms get worse. The person can seek help faster, and yes, it can help the person sooner. Do they need to take any preventive measures? Yes, like I've told you that the therapist will discuss with the person that, if such and such happens, or such and such situation occurs, if you feel that these particular symptoms, because the initial symptoms are very similar for the person. So if the person keeps track, okay, so every time I feel that this is the first thing that happens to me, maybe my sleep, I start losing sleep by 1 hour. This is how I understand that, okay, there might be, I'm having another episode of depression. And this is by understanding and being more insightful about the problem that the person is having. The person can definitely can take preventive measures, so that before the other episode occurs, the person can seek help, or start working on himself before it gets even worse. Thank you for saying this session was insightful. Any other questions before we end the session? Thank you so much. Ayanika has written, how to help a person who is depressed but is in denial of the things and does not want help. I've discussed this and this is a very important question, because many a times many people who are undergoing depression, uh, they will not understand, they might not understand, that is at a much later stage that they are undergoing depression, and that is when the person, the caretakers or the family members have to understand that okay, there is something different about the person is not going about his usual the way he would, and uh, this is when we have to sometimes even force and take that person to seek help. And when the insight is poor, when the person is in denial that there is something wrong, the first step is usually medication, and with medication the insight comes back. And once the insight is back, then therapists, psychotherapists or psychologists start working, where we start treating the person with the problems that he's having, with his negative thoughts, with his low mood, with his lack of interest. But the first step with anyone who's in denial is the family members have to force that person to take help. And the first step is always medication. He or she is suffering from a particular illness. Okay, so I guess we are done with our session. I'll just wait for 2 more minutes, 1 more minute, just to see if there are any more questions. Thank you so much. Thank you so much for calling me, for inviting me over to have this discussion, because it is very important that we spread more awareness. Thank you so much, Mekla Munshi. Yes, it was my pleasure. Thank you for the wonderful questions, everybody. We will come back with a different, another topic next time. I really enjoyed this. I really enjoyed this session. Okay then, bye bye.